Hi everyone, welcome to our Live Well at Home series. You can find us on our social at Live Well Clinic and at dr.soniafeng. Today, what we're going to talk about are a specific pair point along the gallbladder channel that helps with clearing out stagnation to the pelvic area and also to the head, and also helps with clearing out heat, and perfect for PMS symptoms and menstrual issues, things like that. So follow me and we will have Christopher, our acupuncturist, explain more on what these pair points do and demonstrate on Ali, our medical assistant. So here we go. All right. Hi, Christopher.
Well, hello, Dr. Fung, and welcome back. This is Christopher Burnett at Live Well Clinic in our acupuncture room, and I'm really happy to be here for my third time on video, getting better. So today I was asked to discuss point pairs, and knowing a little bit about Ali, we work together and get to see each other here and there. I devised to use two classic point pairs that are each confluent points of the extraordinary vessels, of which there are 8. The point I'll be using in the foot is known as gallbladder 41, and it is the confluent point, the opening point for the daimai, which is a very, it's kind of the smallest extraordinary meridian. It wraps around here in the waist, and it aids qi going upwards or downwards. So women going through their monthly cycles who have abdominal pain, we see most pain, almost all pain, as some form of stagnation of qi. The qi is unable to move up, down, sideways, wherever it's supposed to go in the proper dynamic of qi. So by using this point, we hope to clear the energy through the whole meridian. And then another point that's coupled with this will be the point up on the arm, and I'll talk about that in a few minutes. So to begin, this point, Zuling Qi, is found between the 4th and 5th metatarsal of the foot. It's a little tricky because it's a really delicate, tiny spot. And in the title, in the name of this point, the word tears is found. And I think maybe because it's such a sensitive point, there is a little discomfort. Some people don't feel it. I do my best to be very gentle and tender. But it is a powerful point. It's also the wood point of the wood meridian. It's called a horary point. So I'm going to ask Ali to raise her toes. And by doing this, she's going to extend this toe, and it helps me feel the tendon. I need to go right above this digitorum, but go ahead and let it relax. And we find a little spot, just a little spot beyond the tendon. Okay. Ali, go once more for me. Okay, perfect. So generally we just follow between the bones, and then we get across the tendon into the little divot. Okay, and take a breath. And relax. I'm also using a fairly thin needle for this tiny point. It's only a 0.20. Do you feel that, Ellie?
Just slightly.
Okay, so let me know when you have a little sensation.
No.
Okay. And I may come back and stimulate that a little bit further. At the start, I just want to get the needles in, and I can feel the qi grabbing hold. So again, this particular point activates the daimai channel, and this will help the qi flow through the lower abdomen. Okay. And please extend your toes again. Look at that, beautiful. Thank you, and relax. Okay. And here we go. These are my brand new Korean needles, so very happy to get them. South Korea, thank you. Okay, so those are in. And now I'm going to go back to another famous point that we used recently. And this is Naguan. And it is the confluent or opening point of the yawn linking vessel. So the yawn linking vessel is like the daimai. It's an extraordinary vessel. It's an extra vessel from the initial 12. And it has the effect of regulating the yang qi throughout the body. So oftentimes women with gynecological issues have the restraint here, but then they will get headaches or burning eyes or dry mouth, any kind of symptoms. The constraint here holds for a while, then it kind of just blows, and then here comes the emotions, and here comes headaches and pain. So by activating the yang linking vessel, that extraordinary vessel will help take away the excess and find a place for it to go. So that's what I'm going to do next, is work with. And also this channel, this particular point is also a luo connecting, which means it connects to its interior-exterior pair. Right now we're using Xiaoyang, which is another type of pairing, but by activating this point, we're also activating the pericardium channel, which will absolutely soothe emotions and help relieve stress that one feels in the chest. So this point is just known to be Tutsun away from the point preceding it, but it comes down to just about what we call Tutsun from the wrist area, which is the previous point, Sanjiao 4. I like to palpate. Any tenderness? Miss Sally, do you feel that?
There.
And this one's slightly on the radial side.
You can feel it there.
You feel it right there, yeah. I can feel it too. Okay. And I already came through with a little alcohol wipe. So I'm going to hit this little point. And this point as well, you feel that one? Yeah, I can feel it. Because of where it's located, there is a muscle group and a tendon group. So if she were to move her hands, she's going to really feel that needle. So this is one of the points where I remind people just to let your arms stay relaxed. And as I discover often when I needle myself and I forget I have needles in, I get up and try to walk and I get a real big surprise. Because when we move the muscles, definitely they're going to grab hold of the needles and let us know they're there.
Mm-hmm.
So we're almost at the last point here.
So you do pair points on both sides?
Yeah, we can.
that
I mean,
part-
we could possibly do 1 point here, 1 point there, depending if somebody was really, really sensitive. There's
Okay.
many ways to operate, so we could do one on one side, one on the other. Sometimes we use the healthy side and not even needle the side that's really ill.
Mm-hmm.
Just by activating the other side. The meridians, the truth is it's all one big meridian.
Sure.
We divide them into 12 and 8
Yeah.
and collaterals and luo connecting, but it's all one system.
Okay.
Any sensitivity here?
Down.
A little bit further?
Right there.
Okay. And some of these, points are really interesting. The points show us where the qi and blood gather, but if I had my way, I would just do more palpating.
there.
Okay. Because palpation is really wakes the meridian up,
Mm-hmm.
and then it allows us to really know we're connecting the right areas.
Sure.
Another point that I would use if we're doing a full treatment, there's liver 5 over here is really excellent also for regulating the qi and blood of the liver, which of course would be very connected to the uterus. And another point I would use is just opposite. There's gallbladder points that rise along here. However, the point I'm using, this command point of the daimai, it also joins with the gallbladder meridian as it travels up. So that's the basic treatment for moving qi and blood through
Great.
gallbladder, through Xiaoyang, and hopefully helping Allie feel better today.
Fantastic. Well, thank you again, Christopher,
Thank you
for
so
your
much.
time and always your
I'm smiling under
expertise.
here.
We're all smiling under our
Yes,
masks.
yes.
Thank you.
Alrighty.
Allie.
Thanks. So thank you for watching another installment of our Live Well at Home series, talking about acupuncture, or like Christopher's treatment and acupuncture for PMS and other menstrual symptoms, and also symptoms for like probably endometriosis and or anxiety, a lot of menopausal or perimenopausal symptoms as well. So acupuncture is very fantastic for so many different things because it has a lot of you have meridians all through your body, and it helps to channel and balance out all of those energies. So if you have any questions or you're interested in it, please give us a call. Christopher is here taking patients, and again, enjoy the rest of your week. And if you haven't subscribed already, hit the subscribe button, and follow us on our YouTube and our Instagram. All right, have a great rest of the day. Bye.